Now, let's welcome Shelbourn Stevens to learn the latest about the partnership between Novant Health and New Hanover Regional Medical Center. Shelbourn, it's great to have you here today on this particular day on this show. I understand it's a big celebration for the month of February, and what better person to talk about that other than the president of Novant Health Brunswick Medical Center. So I would like to spend some time talking about that great partnership between Novant Health and New Hanover Regional Medical Center.
Yeah, we're all very excited. We've been looking forward to this day for months now. We've always had a great working relationship locally with New Hanover, but now to have them be part of the Novant Health family, we're really excited about. There's a lot of work that's going to be taking place over the next 2 years. I don't think people will see a lot of changes immediately, other than continuing the great quality care that both the Novant Health Brunswick Medical Center and New Hanover give today. But over time, we'll start seeing some changes and identifying areas where we can improve the health of the communities and serve those patients that may not have access to care, and just really build a really strong regional healthcare system here in Southeast North Carolina.
Well, how do you go about marrying the two in terms of departments, and how is that going to happen? How does that, I know these are...
We have lots of teams that are organized and that are planning in phases, because you can't do it all at once. I mean, the initial piece is to benefits and get the employees over to Novant Health and do a lot of that paperwork. And then you have to start prioritizing. What's the most important? What step do we go first? Which IT systems do we use?
Oh my goodness, I never even thought about that.
Are there name changes down the road that come? And there is a new regional board that was formed for this region for Novant Health.
Oh, well, tell me about that.
Yeah, so there's several community members, some that were on the previous New Hanover board.
Okay.
There's one member from the Novant Health Brunswick Medical Center board, and some new members and physicians that they'll be helping to guide strategy and where we go and where we spend capital dollars for future buildings or renovations for the entire region. So it's really exciting. There still is a hospital board for each hospital that they'll do the legal stuff of physician credentialing and keeping up with quality and safety. But that regional board is really going to help us deliver on the strategic plan for what was New Hanover and then Novant Health Brunswick Medical Center. We're going to marry those two strategic plans together over time and take a regional approach to healthcare.
Now, will there be a connection between the regional board and the board in Charlotte, the Novant Health board? There'll be a connection?
Yeah, there'll be two members of this new regional board from the coastal market, is what we're calling it, that will serve on the parent board of Novant Health. So there will be a voice for the coastal market at that parent company level. And
you did say there will be physicians on the regional board, correct?
There are three.
Because that's always been the case. I know here at Novant Health, there's always been physician input.
Absolutely. That's been our secret sauce, is our physician relationships. And the physicians know healthcare. They're helping us to lead, and we need them at the table.
Right. And will we see any name changes right away, or colors or things like that, or is that further down the road?
I think you'll see lots of ads and billboards right away. Name changes will really be up to that new regional board as to what, if there are name changes, what they may be. But again, we've got all these teams that are working about how do we partner together and who might be over this service line or cardiac services and those kinds. And it's going to take time, and we're not in a rush to get into this. We really want to do it right and continue to provide high-level quality care.
Yeah, I think that's a really good idea, not to rush into it. I mean, we've worked so closely as a team between New Hanover and Brunswick for so long, and we share so many patients already that Do you think that there'll be more services available to the residents of Brunswick County because of this partnership?
Absolutely. I mean, we'll identify some areas where we do not have enough specialists or we don't have them at all, because there are some patients that we transfer to New Hanover that do not really need that higher level of care.
Sure.
They could have stayed in the community hospitals if we had that specialist here. And so I think down the road, and like I said, it's going to take time, we'll see more specialists coming here to Brunswick, or we recruit, and this is where they work out of, so that we can keep patients locally and save those beds at New Hanover Regional for those patients in our region that really, really need that higher level of care.
Yeah, because I know there are times where they are full.
Absolutely.
And it's hard to get patients in.
Yes.
And so that's why I was wondering if there would probably be more specialists who would be willing to come from New Hanover down toward our area to provide office hours, things like that.
And a lot of that's going to help with the partnership of having UNC at the table.
I forgot about them. Tell me about that.
Yeah, so UNC has always had a residency program for years at New Hanover Regional, but
Right.
it's been a smaller program. And with this partnership and merger, we're going to be able to grow that over time and have more residents come down for training. And then when they come to the coast and see how Wilmington and Brunswick County is really nice, they want to stay here. And then we can hire them full time. So it's really going to help us in some specialty areas, especially around pediatrics and internal medicine, family medicine, and some other specialties. And again, it's new. We may grow it even further over time, but I'm excited that we're just going to be this regional hub for top quality healthcare here in Southeast North Carolina.
It's surprising to me how many residents we who do work here in Brunswick already, that like in our OB program, or at Novant Health OB GYN, we've got so many residents, or they were former residents at New Hanover, and now they're physicians here. So, and they have a great residency program.
They do.
Those people come out so qualified and well trained, and you know, no longer do you have to travel far to get great care. So, Shelbourn, tell me what the strategic plan looks like. What down the road, what are we looking at? What are operationally?
A lot of things today are going more outpatient. A lot of surgeries years ago that you spent 3 or 4 days in the hospital, that same surgery is being done today, but outpatient. So we'll be looking at what we call our ambulatory footprint with this new relationship, and how we have the right physicians and specialists in the right locations to serve the region. And then do we have the right imaging services in the right locations? Everybody do not have to come to the hospital for all these studies anymore. We want to make it convenient and meet the communities. This is a fast growing area.
Yes.
And I've seen it in the 15 years since I've been down here. It's a longer drive to get to Wilmington now than it was 15 years ago. But really do an assessment on data and where we need to build those services. That's really going to be our focus going forward, to meet those communities where they need to be met. Another big piece of that is going to be those underserved areas. How do we bring the services to
Yeah, I
them?
wanted to ask you about health equity. There's a lot of talk about health equity and how we resolve some of those issues.
Yeah, there's pockets of health disparities in there, and health equity, we want to make it equal and easy and convenient for everyone. So we'll be looking at the region where those pockets are, and do we build a clinic there? One idea might be, do we have a mobile clinic that goes 2 days a week to this location and this location? So I'm really excited because everyone at New Hanover's leadership and with my team and with Novant Health, we're putting all ideas on the table and really how do we
It must be an
figure this out?
interesting think tank.
It is, and not only with getting services to them, but we're all about health as well. So we got to figure out how we get communities to eat better and not go through the drive-through, and exercise, and are there places to go exercise so that they can be healthy and not have diabetes and overweight and all those conditions that we see all the time.
Well, I heard a rumor about a hospital or a facility called Scottshill.
Yeah, so it's on the north part of Wilmington, near Pender County. They have a freestanding ED there and a surgery center. And they're going to be moving some licensed beds up there to build a patient tower at some point to serve that community. That's a fast-growing area up there. So that'll be part of their future growth.
Is that beyond Porter's Neck, or?
Yes, it's right before you get to the Pender County line.
Oh, wow. So we talk about food deserts and healthcare deserts. Is that area considered a desert for healthcare?
That area isn't, but it's just fast growing. But there are some other parts they call of North Wilmington that there might be one of those deserts where there's not a grocery store to be able to do that. And New Hanover's been working on that for a long time to try to help that community. So there's going to be a lot there. And I mentioned Pender County. Pender Memorial is part of this relationship. New Hanover's been managing them for years, and we're going to continue that relationship to help serve that community as well. So it's really just an exciting time for healthcare in Southeast North Carolina.
And they still have Cape Fear Hospital, correct?
They do. They do. They've talked about numerous plans around that. I'm not sure where they are right now.
So you briefly mentioned IT systems, and I know that New Hanover Regional Medical Center and Novant Health are on Epic, and maybe there'll be a mixture of the two or whatever, but please promise me one thing won't go away, and that's my chart.
No, it's here to stay. That's just the easiest ticket to use to have access to your information and get your appointments, and so that will be there. Which platform we'll be on, we don't know.
We don't know.
We've got plenty of time.
Oh, that's okay. I don't care what platform, as long as I have my chart. That's amazing.
It is.
And what I like about it is I have one place to go, and I can see my New Hanover Regional Medical Center people, and I can see my Novant Health Brunswick Medical Center people.
Absolutely.
And that is so good to have all that information in one spot. And so it makes me feel better when I speak to a physician about my husband or myself, and all that information is right there. It's just a great tool.
It really is, and you can schedule appointments, do prescription refills, ask questions. There's just so much that you can do, but that will remain. That is a platform of Epic, and that will always be there.
Well, good.
And there's more technology that'll come.
Yeah.
Healthcare is evolving every day with new technology, and Novant Health wants to be at the forefront of all that. So we'll see a lot more coming down the pike with new technology to help serve our communities.
Well, in a few months after the dust settles, I would love for you to come back and just keep us posted as much as you can about what progress is being made and where we're going.
Absolutely.
So, thank you. Thank you for your time today. I know how busy you are, and I know how busy the hospital is. And again, thank you all so very much for everything you're doing for the residents of Brunswick County. It's truly a blessing to have it here.
Thank you.